7-3, I copy.
For the last 13 years, Deputy Kishpaugh has been patrolling the streets of Clackamas County. Responding to emergencies is part of his job, but in recent years, he's noticed a change.
Just never really know what you're going to get into.
More and more of the calls he goes to involve a person experiencing a mental health crisis.
Just the other day, I had a gal that was talking to herself on the side of the road, yelling at vehicles and stuff. At least that was perceived. I go out and I talk to her, and she tells me that she's talking to the voices in her head, telling them to go away.
Fortunately, Deputy Kishpaugh doesn't have to respond to these calls alone.
So I don't think people realize how many suicidal calls come into dispatch, and police are going to every single one of those.
Licensed mental health specialist Teal Bohrer is often with him. One of 5 trained mental health clinicians embedded with the Clackamas County Sheriff's Office, Teal assesses the person experiencing a mental health crisis and helps de-escalate the situation.
We weren't able to bring them out with us, we're like, hey, we've got an issue here. I call them up and they come out and respond with us, and they have tools to help us, and it makes it way better.
Mental health clinicians like Teal are embedded with the Sheriff's Office 7 days a week, 24 hours a day, helping those struggling with mental illness. The partnership between the Clackamas County Sheriff's Office and Clackamas County Health, Housing, and Human Services has changed the way those in crisis are dealt with in the community. Clinicians are able to divert individuals from unnecessary emergency room visits and incarcerations by providing them with a full risk assessment on scene, followed by help accessing services.
It's really also about not just taking individuals who are expressing mental health symptoms in the field to jail. So it was an opportunity to get folks to the right place at the right time.
With the number of people attempting suicide rising every year, collaboration between agencies is more important than ever.
The more that we are talking about this, the more that we are leveraging our expertise amongst our system, the more we can actually just talk about mental health as part of health, break down those barriers, address that stigma. This is the only way that we are going to save lives.
Clarissa has experienced the life-saving impact of the behavioral health unit firsthand. Her 24-year-old daughter has schizophrenia. Teal and Deputy Kishpaugh have responded to her house many times, and she says she is so grateful for the help she has received.
Teal has been able to diffuse many situations with my daughter, whether she was agitated, angry.
So if we get them the treatment they need, we can avoid all of that extra chaos in their life and really just get them engaged in the services they need so that they can get healthy, get in recovery, and then hopefully we're not having contact with them with law enforcement in the future.
For now, Deputy Kishpaugh, Teal, and others will continue to do the hard work of reaching out to those in crisis. With the numbers of calls coming in only increasing, their partnership is critical.
Here, our numbers of referrals keep going up as our relationship with the Sheriff's Office continues to grow and get better.
That makes me feel wonderful. It makes me feel like we're helping, and that's what we get into this line of work, to help people.